Sexually transmitted infections, part 2. If you haven't seen the part 1, please go and check that lecture out as well. Um, Syphilis, etiology. It is caused by Treponema pallidum. Trepo means twist and nema means thread. Twisted threads like bacteria. It shows corkscrew motility. Classification congenital and acquired. So syphilis is commoner than you think. Like in my short career, I have seen like 10 cases of syphilis, like active syphilis with the lesions. Congenital syphilis, mode of transmission is mother to fetus in utero. Classification, timeline of manifestation: early, within 2 years of life; late, more than 2 years of life. Early congenital syphilis, snuffles, rhinitis. Triad of early congenital syphilis. Second is hepatosplenomegaly, syphilitic pemphigus, vesiculobullous lesions. Weinberger's sign, bilateral erosion of medial aspect of the upper part of the tibia. Weinberger's sign. Late congenital syphilis. So you saw that early syphilis was within 2 years and late syphilis is after 2 years. So after 2 years, what do they show? Late congenital syphilis, Hutchinson's teeth, notched upper center incisors. Ear has sensory neural loss, interstitial keratitis in the eyes, saddle nose deformity, periosteitis, Olympian brow, frontal bossing, Hikomenaki sign, sternal end of clavicle unilateral, sebre tiber, anterior aspect of tibia, that is sebre tibia. Sebre tibia is a condition where the tibia bone in the lower leg bows forward to the side, giving the leg a shape similar to a saber. Here, so sideways bent tibia. And saber is this. That's a saber. Then other feature is Olympian brow, frontal bossing, and Hikomenaki sign. So let's see what that is about. Hikomenaki sign. Syphilis. So on one sternal end of clavicle, you have the sign. The example shown here. Late congenital syphilis, Hikomenaki sign. Don't want Facebook. Investigation of choice, VDRL titer in infant, 4 times than VDRL titer in mother. Dide-Kazovitz law, untreated syphilitic mother, series of pregnancy, likelihood of infection in fetus in later pregnancy decreases, outcome of pregnancy improves. So the first child is unlucky. Sometimes people don't know they are sick because of low education and resources, stuff like that. Acquired syphilis, mode of transmission, sexual transmission and blood transmission, very easy to remember. Classification, 2 period from infection to diagnosis, time period from infections to diagnosis. So WHO says 2 years, CDC says 1 year. Early acquired and late acquired. Early acquired, primary, secondary, early latent. Late acquired, late latent, tertiary. So primary syphilis, period of infectivity 9 to 90 days. Here there's an example of heart chancre. Clinical features: genital lesions. Primary lesion is a papule, also known as hard chancre, Hunterian chancre. Characteristic: single, clean based, indurated, non tender, does not bleed on touch. Inguinal lymph nodes. Bilateral, enlarged, non tender, rubbery nodes. So these lymph nodes are non-tender and rubbery. Extragenital lesions, chancre over lips, most common. Here dark ground microscopy is showing Treponema bacterium. Investigation of choice: dark ground microscopy of ulcer exudate, slender organism with corkscrew motility. Secondary syphilis, hematogenous spread of organism. So primary is sexual spread, secondary is through blood. Clinical features: fever, generalized lymphadenopathy, epitrochlear node is characteristic. So let's see. Enlarged lesions, skin lesion, symmetric, non-pruritic, polymorphic, except vesicles and bullae. So there are no vesicles or bullae, but it is symmetric, non-pruritic. Non-pruritic is an important differentiating factors from the herpetic vesicles. Polymorphic, that means at different stages. Site, palms and soles. So the syphilis patient that I saw, it was a couple and they had syphilitic lesions on their palms. Sign: Buschke Olean drop sign, blunt end of pin. Pressed on skin lesion, deep dermal tenderness, deep dermal tenderness. So when you press these lesions with a pin, then they elicit tenderness. So they have like deep tenderness, deep dermal tenderness. Mucosal lesions. Condyloma lata. Lata means flat. Flat top moist lesions. Mucosal patch due to breakdown of mucosal area. Snail track ulcers. Coalescing mucosal patches. Serpiginous lesions. So we will see that example: condyloma lata, mucosal patch, and snail track ulcers. Condyloma acuminata, seen in anogenital wart. So condyloma lata is the flat lesions and condyloma acuminata is seen in anogenital warts. Non-scarring alopecia, moth-eaten alopecia, and this is also seen. It is like a patchy alopecia, moth-eaten, like hair comes out in patches. I'll show you condyloma acuminata so you know how to differentiate from condyloma lata and LGV lesions. This is an example. condyloma acuminata, anogenital warts. Syphilis dambly. Dambly means directly. And also the scars, the alopecia is non-scarring. Root, blood transfusion, needle puncture wounds. Secondary syphilis bypassing the primary syphilis stage. Chancre is absent. Investigation of choice VDRL, rapid plasma reagent RPR. So here in Canada, for detection of syphilis, we do VDRL and people have come positive to it. So in my other videos I will share how we approach this people. Latent syphilis, absent clinical features. Serology in syphilis positive. Latent syphilis, absent clinical features. Types: latent, early latent and late latent. So early latent is infectious, late latent is non-infectious. Investigation of choice enzyme immunoassay. Enzyme immunoassay. Tertiary syphilis stages. Tertiary syphilis has gummatous, cardiovascular, neurosyphilis lesions. So gummatous, rubbery nodule, breaks open, ulcer, feature punched out edges, wash leather slough. And cardiovascular, aortic aneurysm in the ascending aorta, most common site, and aortic regurgitation. So syphilis is not playing with you, it has come to kill you, because look what all it does to the heart, CVS system. It causes aortic aneurysm, which is extremely risky. Neurosyphilis, general paresis of insane, paralytic dementia, personality changes, psychiatric changes. So if you have seen the House series, in that they have shown a lady, an old lady who had sudden personality changes and was acting very flirty with House, and no one was able to diagnose her. Everyone thought she was crazy, but House found out that she was sexually active, and no one was thinking about checking her STIs because she was very old, but she was syphilis positive. And then he treated her with penicillin, and she had this personality changes, but unfortunately they were not reversible. Tabes dorsalis, degeneration of sensory neurons in dorsal column, gait abnormalities due to loss of proprioception, lancinating pain, severe in face and extremities, and Urgal-Robertson pupil. Investigation of choice CSF VDRL. Relapsing syphilis. So we will see an example of neurosyphilis, that because it sounds very interesting. Neurosyphilis ducts. Gamma appears at previous site of chancre. Drug of choice, injection benzathine penicillin. So government of Canada supplies free penicillin to give to all the patients who test positive for syphilis, and it is this formulation itself called benzathine penicillin. It is stored in the fridge, and dosage is 2.4 million units. Route is deep IM in the buttock. Duration: early syphilis 1 dose, late syphilis 3 doses, once weekly, so the patient keeps coming back. Sometimes they just give 1 dose if it's an early syphilis. And neurosyphilis, drug is injection aqueous crystalline penicillin, because the benzathine penicillin cannot cross the blood-brain barrier. So if there is neurosyphilis, then you need to give injection aqueous crystalline penicillin. This is benzathine penicillin IM, aqueous crystalline penicillin for the CSF absorption. 18 to 24 million units. So this is 2.4 and this is like 20 times, so 24 million units. Root IV daily for 10 to 14 days, patient hospitalized. So daily 18 to 24 million units. Allergic to penicillin in non-pregnant individuals and pregnant individuals. In pregnant individuals, desensitization with penicillin, therapeutic dose of penicillin. So you can do desensitization to penicillin and then therapeutic dose. Non-pregnant individuals, doxycycline 100 milligram BD, early syphilis and late syphilis. Early syphilis 2 weeks, late syphilis almost 1 month, 4 weeks. So if the patient is pregnant, you have to give penicillin, you need to desensitize them. And if it is non-pregnant, then you can give doxycycline. Early syphilis 2 weeks, late syphilis almost a month, for that is 28 days. Desensitization, pathophysiology, repeated administration of subthreshold doses of penicillin. Antigenic determinants bind to the IgE of surface of basophils and mast cells but do not cross-link. Cell membranes unresponsive to higher dose. Complication of penicillin therapy, hypersensitivity reaction, urticaria, angioedema, anaphylaxis. This is a life-threatening condition. Patient can die within minutes. Anaphylaxis, Jerish Herxheimer reaction. Acute febrile inflammatory reaction seen after chemotherapy initiation in spirochetal diseases like Lyme's disease, relapsing fever, onset within few hours of chemotherapy. Pathogenesis, penicillin administration, lysis of spirochetes, release of lipoproteins into circulation, release of cytokine, acute inflammatory reaction, fever, myalgia, hypotension, worsening of existing skin rashes, treatment self-resolving, symptomatic fever and SIDS. Chancroid, organism Haemophilus ducreyi, incubation period 3 to 7 days. Lesion, primary lesion pustule. Genetic ulcer, also known as soft chancre or soft sore, while in syphilis there was a hard sore or hard chancre. Multiple necrotic base, ragged and undermined edge, undermined edge, wherein syphilis ulcer there was a leather slaw appearance, indurated, and also the edges were raised. Non-indurated, tender, bleeds on touch. So you should know how to identify indurated versus non-indurated lesion. How to, let's see. Induration has skin hardening. So it is done by palpation, feeling the area and assessing where the raised area has a hard resistant feeling, because there are many different underlying causes of induration skins. So in short, indurations has mass in it. You can feel that there are cells like actual proliferation, and it is hard to touch. Primary syphilis, hard chancre. So we were in Haemophilus ducreyi lesions, which causes chancroids here. So these are non-indurated lesions, and primary syphilis has hard chancre lesion, clean, single, clean based, indurated, non-tender, does not bleed on touch, whereas these are tender. Inguinal lymph node, bubo. Unilateral enlarged tender suppurative lymph node, concomitant genital ulcer. Investigation, gram stain from ulcer exudate, gram negative cocobacilli. Long parallel strands. School of fish railroad appearance. This I still remember. School of fish appearance in Hemophilus tucri, Hartshenker, uh, gram negative cocobacilli. Culture medium Muller-Hilton agar. 5% chocolatized horse blood agar. Treatment tablet azithromycin 1 gram stat. Herpes genitalis. Organism HSV2 90%, HSV1 in 10%. Incubation period 3 to 10 days. Lesions, vesicles, primary lesions, fluid filled lesions less than 1 centimeter. Genital, then it ruptures, and multiple grouped ulcer, polycyclic margins, genital ulcers. Inguinal lymph nodes. Bilateral enlarged tender. Investigation zinc smear, cytodiagnostic technique. So whenever there are vesicles, here in Canada, doctors actually send the samples for testing. So they take the viral transport medium and then swab the lesions and send it for testing, and they actually tell you what kind of virus or bacteria it is. So zinc smear, cytodiagnostic technique. Vesicle deroof glass slide, stain with Giemsa stain. Findings multinucleated giant cells. Treatment tab acyclovir 400 mg 3 times a day for 7 days. Red kid in syndromic management. Very commonly given. Lymphogranuloma venerum. Etiology, organism, chlamydia trachomatis, serovirus L1, L2, L3. Tropism, genital lymphatics. Incubation period 3 to 30 days. Lesion, bilateral bubo. Lesion, genitic ulcer primary stage, single painless herpetiform, transient ulcer. Inguinal lymph node secondary stage, enlarged lymph nodes, bubo. Symmetry, unilateral in 2/3, bilateral in 1/3. Groove sign of Green-Polt, enlarged lymph node above and below the inguinal lymph ligament. Concomitant ulcer absent, ulcer is transient. Complication, so by the time a patient comes to you, the ulcer might not be there. Complication, tertiary stage, genetic elephantiasis due to affinity to genetic lymphatics in males, saxophone penis in females. Asthiomin, genital elephantiasis plus chronic ulcerations. So that happens in LGV. Lymphogranuloma venerum, chlamydia trachomatis, L1, L2, L3 serovirus, elephantiasis plus chronic ulceration, isthiomin, saxophone penis. Investigation of choice, nucleic acid amplification test NAT. Treatment doxycycline 100 mg BD for 3 weeks. Donovanosis. Organism Klebsiella grabulomatosis. Synonym granuloma inguinale. Incubation period 8 to 80 days. Note: Leishmania donovanosis causes leishmaniasis. So don't be confused by the name. Leishmaniasis donovanosis causes leishmaniasis, but Klebsiella granulomatosis is causing donovanosis. Similar names. Genetic lesions. Genetic ulcer. Genetic ulcer in donovanosis. Single painless genetic ulcer. Characteristic finding: beefy red, exuberant granulation tissue due to high vascularity. Bleeds on touch. Very important finding. It bleeds on touch. Inguinal lymph nodes not involved. Pseudobubo. Subcutaneous nodule in the inguinal region. Granuloma. Subcutaneous nodule inguinale. Granuloma inguinale. Investigation: crushed tissue smear. Small piece of tissue from ulcer crushed between two glass sides. Smear ginza stain. Findings: large mononuclear cell, Pund cell. Intracellular Donovan bodies. Inside mononuclear cell. Closed safety pin appearance due to bipolar condensation of chromatin. Pund cell. Large mononuclear cell. In Leishmaniasis donovanosis you saw LD bodies. Treatment: tablet azithromycin 500 mg daily or 1 gram per week. Duration 3 weeks or till ulcer heals. Approach to genetic ulcer disease. Genetic ulcer disease. You see, if it is single and non-tender, primary syphilis, lymphogranuloma venerum, donovanosis. If it is multiple and tender, chancroid, genital herpes. Inguinal lymph nodes. Not involved, donovanosis, but it can have pseudobubo. Involved, then it could be non-tender, primary syphilis where it is rubbery, or it could be tender, bilateral, presence of bubo absent, genital herpes, bubo present, presence of concomitant genital ulcers, if present, chancroid, if absent, LGV. So this is how you differentiate. Genetic ulcer disease. First thing you see is how many, single or multiple. Then you see if it is non-tender or tender. If it's non-tender, then it could be syphilis, LGV, or donovanosis. If it is multiple and tender, then it could be chancroid or herpes genitalis. Inguinal lymph nodes you check next. If they are not involved, it is donovanosis. If it is involved, then you check if they are non-tender or tender. If they are non-tender, then it is syphilis, rubbery lymph nodes. If lymph nodes are involved, then you see that it is non-tender or tender. If non-tender, then it is syphilis. If they are tender, then you check if it's bilateral. If it's bilateral, you check and you find presence of a bubo. Then you check bubo, and if it's absent, then it is herpes. But if it is present, then you check if there are anogenital warts or ulcers. If anogenital ulcers are present, then it is chancroid, and it is absent, then it is LGV.